This conference will now be recorded.
Good morning, everyone, once again. And today we will be seeing about the venous drainage and the lymphatic drainage of the upper limb. Okay. Okay, I hope you are able to see my screen now.
Yes, doctor.
Okay. So the upper limb, you know that the upper limb is starting from the shoulder girdle until the fingers. So we will be saying about the arterial drainage will be taught to you respectively. Okay, so like what are the arteries in the, suppose in the arm, when we are discussing, we will be telling you about what are the arteries which are there in the arm, forearm, hand, like that. Okay, so in this we are just going to cover up the overall venous drainage. Okay, overall venous drainage and the lymphatic drainage of the upper limb with some clinical perspectives. Okay, with some clinical perspectives in mind. Okay, all right. I'll give you time to ask questions. Okay, so if you have any questions, you just make a note of it and then I'll give you time. Okay. The venous drainage, whenever we are discussing about the arteries, we will be starting from the proximal towards the distal part. Whereas when we are discussing about the venous drainage, we will be starting from the lowermost portion, we will be starting from the distal towards the proximal. Okay, so the dorsal venous network. So dorsal means the dorsum of the hand. Okay, you know the dorsum of the hand. Okay, that is, you know the palm, the opposite of that palm, which is on the back side of the palm. So that's called as the dorsum. Okay, so the dorsal venous network. In this, there are dorsal digital veins. So these dorsal digital veins, they unite and then they form three dorsal metacarpal veins. Okay, over the metacarpal bones. Okay, over the metacarpal bones. I hope you know what are the metacarpal bones, right? So the bones which are present in the dorsum of the hand, not on the fingers. The finger bones are called as phalanges. Just proximal to it, you will have 5 metacarpals. So between this metacarpal, there will be the metacarpal veins. Okay, and these veins they laterally join. Okay, in the lateral part, the dorsal digital vein from the index finger. Okay, so from the index finger, they join the network and is prolonged as cephalic vein. Whereas medially, along the little finger, they join together and they form the basilic vein. I'll show you in the picture. Yes. So in this picture, you are able to see these are the dorsal digital veins. Okay, the dorsal digital veins. Okay, so these dorsal digital veins join together to form what is called as metacarpal veins. Okay, so these are the metacarpal veins, and these metacarpal veins in the lateral part, okay, in the lateral portion. Okay, so how do we say this is lateral? Because of the anatomical position. Okay, so this is the lateral part. In the lateral part, they form a vein which is called as the cephalic vein. They all unite together and then they form the cephalic vein. Whereas on the medial portion along the little finger, they all unite to form what is called as the basilic vein. These are the superficial veins. What we are discussing is about the superficial veins. So what are these superficial veins? The superficial veins are the ones which are found in the superficial fascia. Okay, so they are found in the superficial fascia. Okay, so they are found in the superficial fascia. Okay, so the superficial veins found in the superficial fascia. So there are something called as deep veins that we will discuss later. Okay, so which is found below the deep fascia. Okay, so below the deep fascia, these are the deep veins, and above, that is in the superficial fascia, we will be able to see the superficial veins. So in the superficial veins, laterally there is cephalic vein, and medially there is basilic vein. Do you have any doubts until now? Okay. So this is yet another picture showing the distribution of the superficial veins. Okay, the dorsal digital veins you can see, they all unite together to form the metacarpal veins. Okay, the metacarpal vein, this is called as dorsal venous network. Okay, and then these dorsal venous network, they finally join laterally to form what is called as cephalic vein, and medially they form the basilic vein. Okay, and they run up proximally. Okay, they run up proximally. Okay, all right. Now let's see each one of these veins in detail. The cephalic vein is formed over the anatomical snuff box. Okay, there is a portion in the hand which is called as anatomical snuff box. Snuff box, you know that it's a small box. Okay, it's a small box like structure. Okay, so which in the olden days the old people used to have some tobacco in it and then they used to snuff. Okay, so but this is different. This is anatomical snuff box. That is, it resembles like a box, okay, which is present in our body. Okay, so we will be seeing about it later. So this part is called as anatomical snuff box. Okay, it is between the tendon of two muscles. Okay, and there is a depression there. Okay, and that's why they call like this is the anatomical snuff box. What are these tendons? We will see it later when we are discussing about the hand. So the cephalic vein starts near the anatomical snuff box. Okay, they start near the anatomical snuff box and they run over the lateral aspect of the radius. You know, the bone which is present on the lateral side is the radius. So they go along the lateral aspect of the radius. Okay, and they go across the forearm. Okay, near the elbow. Okay, just distal to the elbow, there is a branch. Okay, the median cubital vein. Okay, so there is a branch which is called as the medial cubital vein. Okay, the median cubital vein. Okay, the median cubital vein, it diverges proximomedially to reach the basilic vein. Okay, so this, there is a vein. I will just show you in the picture. Okay, so there is, remember, there is a branch which is arising from the cephalic vein and then goes towards the basilic vein. Okay, and this is near the elbow. Okay, near the elbow, which is called as the median cubital vein. The course. Okay, the cephalic vein, it ascends anterior to the elbow. Okay, it is present anterior to the elbow between these two muscles, brachioradialis and biceps brachii. Okay, so that is, these are the two muscles. So it passes between these two muscles. Okay, and then it ascends lateral to the biceps muscle. This is a muscle which is present in the forearm, and it passes between the pectoralis major and deltoid muscle. So these are other muscles which are present near the shoulder joint. So it passes lateral. I'll show you in the picture. Okay, and it enters the infraclavicular fossa. Okay, so there is a fossa below the clavicle, infraclavicular fossa. Okay, infra means below, clavicle, fossa. Fossa is a depression. Okay, so it enters the infraclavicular fossa and there it pierces a fascia, which is called as the clavipectoral fascia. Okay, and after it pierces the clavipectoral fascia, it joins the axillary vein. Okay, it joins the axillary vein. Okay, it joins the axillary vein just below the clavicular level. Okay, I'll just show you the picture now. Okay, so here, first concentrate on the cephalic vein. Okay, the cephalic vein, now you know that it is in the lateralmost part. Okay, it is present in the lateralmost part. Okay, you can see that the cephalic vein, it arises from the lateral aspect near the anatomical snuff box. Okay, and then it goes laterally in the forearm. Okay, and there is a branch, there is another vein approximately near the elbow. Okay, and this vein, okay, it connects the cephalic vein to the basilic vein. Okay, and the name of this vein is the median cubital vein. Okay, the name of this vein is the median cubital vein. So this is the median cubital vein. Then what happens? This cephalic vein, it goes lateral. So this is a muscle, which is the biceps muscle. Okay, so it goes lateral to this biceps muscle. Okay, and then it goes near the shoulder joint. Okay, and in the shoulder joint, it goes between the muscle. There will be a muscle here which is called as deltoid. Okay, which is not shown here, it is removed. Okay, and here there will be pectoralis major. Okay, so there will be a muscle here which is the deltoid. Okay, and there will be a muscle here which is the pectoralis major. So it passes between these two muscles. Okay, it passes between these two muscles, and then it enters. Okay, it enters below the clavicle. Okay, you know the clavicle. So this is the clavicle. It goes below the clavicle. Okay, in the infraclavicular fossa. Okay, so below the clavicle there is a fossa. The depression is small depression. So that is the infraclavicular fossa. So here it enters into the infraclavicular fossa, and in the infraclavicular fossa there is a fascia, a deep fascia. Okay, a deep fascia which is called as clavipectoral fascia. Okay, clavipectoral fascia. Okay, so it pierces this clavipectoral fascia and then it enters into the axillary vein. Okay, it enters into the axillary vein. Okay, I will once again repeat it. The cephalic vein is formed in the anatomical snuff box in the lateral aspect of the radius. Okay, near the elbow, it gives off a branch which is the median cubital vein. It ascends between brachioradialis and biceps, and lateral to the biceps, it goes between pectoralis major and deltoid. It enters the infraclavicular fossa, piercing the clavipectoral fascia, and then joins the axillary vein. Any doubts in the cephalic vein? Do you have any doubts? All right.
What is a brachioradialis?
I can't hear you. Can you please be a little bit loud?
What is a brachioradialis?
Yes, brachioradialis is the name of a muscle. See, all these are names of the muscle. Okay, so which they will be teaching you in the respective parts. Brachioradialis, it's a muscle. Okay, biceps brachii is a muscle. Okay, this is also same. This is the biceps brachii. Okay, pectoralis
Okay.
major is a
Yes.
muscle. Deltoid is a muscle. Okay, this is a fascia. Clavipectoral fascia, this is a fascia. Okay, it's a deep fascia. Okay, when you are dissecting, you know that there are different layers, right? So there is skin,
Yes.
superficial fascia, deep fascia. So the deep fascia which is present near the shoulder joint, so that's the clavipectoral fascia. Okay.
Yes, thank you.
Oh, thank you. All right, now let's go to the basilic vein. The basilic vein. The basilic vein, as you know, that it arises in the medial aspect. Okay, it arises in the medial aspect of the dorsal venous arch, and it ascends in the posteromedial aspect of the forearm and joined by the median cubital vein around the elbow. The basilic vein continues as the axillary vein from the lower border of teres major. Okay, so now let's see this one in this picture. We have seen the cephalic ones. Now let's see the medial part. Okay, that is the basilic vein. So you can see that the basilic vein is present along the medial aspect of the forearm. Okay, then it comes near the elbow, and here you can see there is a vein which is connecting the cephalic and the basilic vein, and what name is that? The median cubital vein. Okay, the median cubital vein. So it joins this median cubital vein and then it ascends medially along the biceps brachii. Okay, so here it ascends along the medially along the biceps brachii, and then here it pierces through the deep fascia. Okay, it pierces along the deep fascia. Okay, and then it passes a bit deeper to the deep fascia. Okay, and here there will be another one muscle. Okay, so which is once again not shown, which is the teres major. Okay, so this beyond this teres major, the same, it's a muscle. Teres major is a muscle. Okay, so beyond this muscle, this name is given as, so this is the teres minor, teres major. So beyond this part, okay, it is called as the axillary vein. Okay, this is the teres major muscle. Okay, so this is the teres major. On the back side, you are able to see a muscle. Okay, the teres major. Okay, above it will be the teres minor. Okay, major and minor. Okay, so the muscles name, you know that why they have been given. A muscle which is huge, okay, it's called as major, and the same muscle which is present in the same region but a little bit smaller, it is called as uh, minor. Okay, teres minor. Okay, teres minor. Just a second. I know some of you are typing in the chat, but please excuse me, I cannot see your chat messages right now. Okay, I will, if you want, you can unmute your mic, or at the end of the class, you can ask me your doubts. Okay, or I'll give you time. Okay, so once again, the basilic vein, sorry, the basilic vein, it starts in the medial side. Okay, and near the elbow, it is joined by the median cubital vein. It then ascends and pierces through the deep fascia and beyond the teres major muscle. Okay, so the same vein is called a different name, which is the axillary vein. Okay, which is called as the axillary vein. Okay, so beyond this, it's called as the axillary vein. And beyond this point, it is called a subclavian vein because it is present this say below the clavicle. It is called as a subclavian vein. Okay, right or left. Okay, if it is present on the right side, we call it as right. Okay, the right axillary or right axillary vein. If it is present on the left, we call it as left axillary, and similarly for the subclavian veins. Okay, so once again, the basilic vein, it arises medially and it ascends posteromedial aspect of the forearm, and here it is joined by the median cubital vein. Okay, median cubital vein. The basilic vein continues as axillary vein from below the lower border of the teres major. Okay, the same vein, it's been given a different name. Okay, just like you know that a road after a certain highway road, after a certain point we give it a different name. Okay, so the same road, okay, in different parts it's been given a different name. All right. Similarly, the axillary vein the basilic vein after the lower border of teres major, it's been named as axillary vein. Any doubts until now?
Sir, the muscle that comes above the axillary vein, it's called teres major.
Yes, teres major. It's a it is a muscle. This is also a muscle. Okay, so you will be learning about these muscles. Okay, in your further classes. Okay. All right.
Okay, thank you.
The next one is the axillary vein. Okay, the axillary vein. The axillary vein, it is the continuation of the basilic vein, as we have seen. Okay, it is the continuation of the basilic vein. It begins at the lower border of the teres major. Once again, this is a muscle. So we use this as an anatomical landmark. Okay, so it begins at the lower border of the teres major and ascends to the outer border of the first rib. Okay, so the axillary vein, it is present. It is the same vein, the basilic vein beyond the teres major. It's called as axillary vein. Okay, until which part? Until the outer border of the first rib. What happens after the first rib? The same vein, the axillary vein which is continuing, is now being given a different name, which is the subclavian vein. Okay, the same vein, the basilic vein, it ascends beyond teres major, it's called as axillary vein, and until the first rib. Okay, beyond the first rib, it's called as subclavian veins. Okay, now what are the tributaries for this vein? Tributaries are small veins which joins the axillary vein. Okay, so there are many veins, smaller veins, but mainly, they are joined by the brachial veins near the subscapularis. Subscapularis is another muscle. So this is another muscle. So they are joined by another vein which is called as near the brachial vein near the subscapularis muscle, and the cephalic vein near its costal end. Okay, I will just show this in the picture. So we have seen the basilic vein. We have seen the basilic vein until here. Okay, now from here until the outer border of the first rib. Okay, so this is the axillary vein. Okay, so until this is the first rib, right? Okay, so from here to here, this is the axillary vein. Okay, that is from the lower border of the teres major until the outer border of the first rib. The same vein, you can see it's been given different names. So this is called as the axillary vein. Okay, now here you can see it's been joined by another vein which is called as a brachial vein. You can see some smaller veins which are joining here. Okay, so those are the brachial veins. And if you go above the axillary vein, here you can see there is a vein which pierces this clavipectoral fascia and then joins the axillary vein. What vein is that? We have already seen it, the cephalic vein. Okay, so it is joined by these brachial veins, okay, and by this cephalic vein. Okay, and then it proceeds until the lower border of the first rib, beyond which it is called as the subclavian vein. Any doubts? Any doubts?
Sir, can you say again what is the subcranial vein?
You mean subscapularis? Do you mean the subscapularis?
Is it called subcranial or subclav?
Subscapularis. Subscapularis.
Oh, okay, okay.
Okay. See, remember, I will just give you a small clue. Okay, the names of the muscles can be confusing. Okay, especially for the first time blind learner, it could be confusing. Okay, remember most of the names are named depending on the location or the action or the size. Okay, so here if you see subscapularis, why this name is named as subscapularis? This muscle is present below the scapula. So that's why it is named as subscapularis. Okay, you know submarine. Why it's called a submarine? It goes below the, marine means water, it goes below the water. Okay, so this muscle is present below the scapula. So that's why it's called a subscapularis. Okay, teres major. Teres means round. In Latin, it means round. Okay, and there are two muscles which are round. One is big and another one is small. Okay, so this muscle is called as teres major because this is round and it's quite big compared to the other muscle. So that's why this is called as teres major. Okay, similarly, the other muscles, just let me show you. I'll just give you a clue on that. Here there are no muscles. Yes, brachioradialis. Here we have seen some muscles. Brachioradialis. Brachio means arm, brachium, arm. Okay, so this muscle is present in the arm and is getting inserted into the radius. Okay, the radial bone. Okay, so that's why this muscle is called as brachioradialis. Biceps brachii. Brachii, you know, it is present in the arm. Biceps. This muscle has got two heads. Sept means head, two heads. Biceps. Okay. Similarly, there is a muscle which is called as triceps, quadriceps. Okay. So biceps means it has got two heads. So that's why this is called as biceps brachii. Okay. Similarly, the pectoralis major. Pectoralis means the chest, pectoral region is the chest. So there are two muscles which are present in the chest. One is big and another one is small. So when we are comparing, so we say that this muscle is pectoralis major and below this there is another one. Whenever I say major, there is a minor. Okay, so pectoralis major, so there is another one muscle which is called as pectoralis minor also. Okay, deltoid. Why this muscle is named as deltoid? Because it resembles the shape of a deltoid. You know the deltoid, right? Like an inverted triangle. Okay, the delta region. Okay, so it looks like a delta. Okay, so this is called as deltoid muscle. Okay, so the names of the muscle can be a little bit tricky. Okay, so remember like why it is named. If you know like why it is named and you can visualize the structure, okay, then it becomes easier for you. All right. Any other doubts? All right. Now, this is the surface anatomy. So, in a living person, okay, a muscular person, so where the venous networks are more prominent, and you know that this is the elbow region. So, in the elbow region, so this part is called as the cubital fossa. Okay, so this part is called as cubital fossa. So we will see about this cubital fossa in my next class, which is on Wednesday, I guess. Okay, on Wednesday, we will be seeing about this, the cubital fossa. So in this cubital fossa, there is this vein, which is the median cubital vein. Now the median cubital vein is the one which joins the cephalic vein and the basilic vein. Okay, the lateral part which is the cephalic vein and the medial part which is the basilic vein. Okay, the median cubital vein. Okay, And there are certain other muscles. They have already shown you the biceps brachii muscle. There is another one muscle which is called as pronate arteries. Okay, no need to know that now. Okay, I will tell about this muscle later. Okay, and the median vein of forearm. There is one vein which is present in a small tributary, which is the median vein of forearm. Okay, the median vein of forearm. Okay, now let's see in detail about, okay, in detail about this veins. So this is how in the veins which has been given in your books. Okay, you see there are so many veins. Okay, small veins which are present. Okay, at least try to remember the major veins. Okay, anatomically, if you see this, they might not be of much importance, but clinically the veins are of much importance. Okay, the veins are of much importance because whenever you are giving any IV fluids, intravenous fluids, okay, we use, or withdrawing blood, okay, so we use veins. Okay, we do not puncture arteries frequently. Okay, we usually puncture the veins for giving any fluids, okay, for withdrawing any blood. Okay, that's because the veins have got thin wall. Okay, you already know that. Okay, so the veins have got thin wall and the arteries have got thick wall. Okay, so and the damage to the veins, it heals very well quickly compared to the damage to the artery. Okay, so here you can see all the veins which have been given here. Okay, so here you can see the dorsal venous network. Okay, on this side, the dorsal venous network. Here they form what is called as the cephalic veins. They have not shown the cephalic veins. Yeah, here the basilic vein. Okay, the basilic vein, the axillary vein. Okay, the axillary veins, which are shown in bold colors. Okay, in the bold letters. Okay, so don't forget to know the bold letter ones. Okay, now what we have seen until now is the superficial veins. Now there are some veins which are called as deep veins. As I said before, they are deep veins. The deep veins which are found deep to the deep fascia, they are found deep to the deep fascia. They follow the arteries of the same name. Okay, say there is a radial artery and an ulnar artery. Okay, so along with it there will be a vein which is called as the radial vein and an ulnar vein. Okay, there will be a superficial palmar arch and a deep palmar arch. Okay, which are the arteries. Okay, similarly there will be a venous drainage which is called a superficial venous palmar arch and deep venous palmar arch. Okay, and these veins, the radial veins and ulnar veins, they all join together to form what is called as the brachial vein. Okay, and you know that this brachial vein is the one which joins the axillary vein. You remember, near the subscapularis. Okay, this is the brachial vein. The brachial vein is the one which joins the axillary vein. Okay, near the lower border of the subscapularis. It goes and drains into the axillary vein, and from the axillary vein it goes until the outer border of the first strip, the axillary vein, beyond which it's called as the subclavian vein. And the subclavian vein joins with internal jugular vein. Okay, yeah, the internal jugular vein. Okay, the subclavian vein joins with the internal jugular vein to form the brachiocephalic vein. The two brachiocephalic veins on either sides, they join together to form the superior vena cava. Okay, which then opens into the heart. Okay, so just follow the names of the arteries, of the veins, okay, from distal to proximal until it reaches the heart. Okay, so here it stands as the superficial and deep venous palmar arch. Okay, then these unite to form the radial and the ulnar veins. The radial and ulnar veins, they join near the elbow to form what is called as the brachial veins. Okay, the brachial veins drain into the axillary veins. The axillary veins continues as the subclavian vein. The subclavian vein joins with the internal jugular to form the brachiocephalic vein. The brachiocephalic vein joins to the opposite side, that is the right, joins with the left brachiocephalic vein to form the superior vena cava, which then drains into the heart. Okay, so this is the anterior view and this is the posterior view, the same veins. You need not remember the small veins, okay, because usually there will be some kinds of variations. Okay, so there are some smaller veins, but at least remember the major veins. Okay, the ulnar vein, radial vein, brachial vein. Okay, so those things you should not forget. All right, any doubts? All right, now let's go to the next one. This I will give you as your worksheet, or you can answer. I will give you some 2 minutes. You can work on it. Okay, and you tell me like what is this A, B, C, and D?
Is A subclavian?
Very good. A is subclavian.
And
B is axillary vein.
Very good. B is axillary vein. Yes. How about C and D? Okay, now I'll give you a clue. So you can see that there is a clue here. The dark blue ones are the deep veins and the light blue ones are the superficial veins.
is the D
Okay.
basilic? No.
Basilic. It's a basilic. Basilic is a superficial vein or a deep vein? Yes. So is D dark blue or light blue?
It's dark.
It's
But
dark.
basilic is
So
D is
superficial,
a
right? But
brachial vein.
yes, very good. D is the brachial vein. D is the brachial vein. Okay, because it is dark blue, it is a deep vein. Okay, and this one is the basilic vein. Okay, I have not coded it. Okay, so this one is the basilic vein. This one is the cephalic vein. This is the median cubital vein. Okay, the median cubital vein. Okay, and what is this C? Okay, if you have doubt, you can go to the previous slide. Okay, and here you can see there is a vein which goes and drains into the axillary vein. What is that? Lateral thoracic vein. Lateral thoracic vein. Okay, so that just I gave it. Okay, so that you will know like what are all the veins. Okay, it's just to know it. Okay, but these are the veins which you need to remember. Okay, so you try to figure out the other veins. Okay, the names of the other veins using this template. Okay, or any other template which you can find it from your book. Okay, so try to find out the names for each one of them. Okay, and remember the clue, the light blue ones are the superficial veins and the dark blue ones are the deep veins. Okay, so the superficial deep vein, palmar arch, palmar venous arch. Okay, there will be radial ulnar veins, the radial veins. Okay, so this is the radial vein, the cephalic vein. Okay, like that. Okay, so try to decode. All right. So once again, the median cubital vein. Okay, why are we discussing? These are some of the other pictures. So here you can see the basilic vein. it passes through the deep fascia in the middle of the arm. Okay, the cephalic vein, however, is superficial throughout until it pierces the clavipectoral fascia. So here you can see the cephalic vein, and here you can see what is the name of this muscle?
Deltoid.
Yes, this is the deltoid muscle. Okay, and this muscle is cut. What is this? It's a muscle which is present in the chest.
Pectoralis major.
Yes, this is pectoralis major. Okay, so beyond the pectoralis major, there is a deep fascia. You can see a grayish membrane, which is the fascia. What is the name of this fascia? It is present below between the clavicle and the pectoralis major. Clavipectoral fascia. Okay, clavipectoral fascia. So this deep fascia it's called as clavipectoral fascia, and you can see the cephalic vein is passing below the infraclavicular fossa, and it pierces through the deep fascia, that is the clavipectoral fascia. Okay, and then it continues down. Okay, it continues as drains into the axillary vein, and from the axillary vein it continues as the subclavian vein. Okay, so here also you can see the cephalic vein going between the deltoid and the pectoralis major. Okay, so this is in short, this is a schematic diagram showing the superficial and the deep veins. Okay, so here the shown it in the opposite way. Here the superficial veins, they are shown in dark blue color, whereas the deep veins, they are shown in the light blue color. Okay, so some of you might find that this one is easy. So superficial venous arch, deep venous arch, radial vein, ulnar vein, they join together to form the brachial vein. Okay, here the cephalic vein and the basilic vein. Okay, so this is the median cubital vein of forearm or median antebrachial vein. Okay, and these both veins are joined by the median cubital vein. Okay, the cephalic vein joins with the axillary vein. The basilic vein continues as the axillary vein. Okay, and then as the subclavian vein. Then it joins with the internal jugular to form the brachiocephalic vein. The brachiocephalic vein joins with the opposite side to form the superior vena cava. Okay, so this is just a schematic diagram. Okay, any doubts regarding the venous drainage? All right. All right, so this is again the next topic is regarding the lymphatic drainage. So before the lymphatic drainage, I would like to ask you a question. Okay, so for which you find out an answer and give me in my next class, which is on Wednesday. Okay, many of us, almost all of us, would have gone through medical checkup at some point of time. Okay, blood tests. Okay, and you must have observed when they are taking blood, they usually take blood from the elbow, isn't it? They take the blood from the elbow. You must have observed it. Okay, now which vein they use? Out of all these veins, which vein do you think they must have used for withdrawing the blood?
Cephalic vein.
Is that the median?
It is the cephalic vein? No. It's the
Median cubital?
median cubital vein. Okay, so you can see that in the picture, they usually use the median cubital vein. Okay, so that you already know from the picture, but my question is, why do they use median cubital vein for withdrawing blood? Why not a basilic vein? Why not a cephalic vein? Okay, you must have observed every time when you go for blood tests, okay, the nurses or the lab technicians, okay, so sometimes doctors, okay, so for withdrawing blood, Okay, so they usually use this median cubital vein. Okay, now you find out the reason for why they use the median cubital vein, okay, for withdrawing blood, and preferably, okay, preferably, okay, the first choice will be mostly the median cubital vein. Okay, let me know why they use the median cubital vein and not the cephalic or the basilic veins. Usually, okay, they may use the cephalic or the basilic veins. I don't say they will not use, but usually they prefer the median cubital vein. Okay, find out and tell me the answer in my next class. Okay, which is on Wednesday. Okay, all right. The next part of today's session is about the lymphatic drainage. Don't worry, it won't go long. Okay, I'll be completing it another 20 minutes probably. Okay, so the lymphatic drainage. Okay, the lymphatic drainage is also similar to that of venous drainage. So there is superficial lymphatics as well as deep lymphatics, and they accompany the veins. Okay, the superficial lymphatics, they accompany the superficial veins, and the deep lymphatics, they accompany the deep veins. Okay, the lymphatic vessels along the basilic vein, okay, basilic vein which is present on the medial side, okay, they go into small group of lymph nodes which is present near the elbow, and that's called as the cubital lymph nodes. And from the cubital lymph nodes, they drain into the lateral axillary group of lymph nodes. Okay, so basilic vein, it goes into the cubital lymph nodes and then into lateral axillary group of lymph nodes. Along the cephalic vein, which is present on the lateral side, they go into the apical group of lymph nodes. Okay, apical axillary group of lymph nodes. Okay, now if you see in the axilla, okay, so is the class over? Was the class over on axilla? Is the class over on axilla? Anybody can unmute and tell? Axilla has been taught?
No, doctor.
Oh, okay, no problem. So in the axilla, there are axilla, if you see, it is just like a pyramid. Okay, pyramid. Okay, you know, in the pyramid, there will be, so it is like a pyramid like this. Okay. Okay, so there is an apex, okay, an anterior border, a posterior border, okay, a lateral border, and a medial border. Okay, so similarly, in each one of this part, the axilla is resembling like a pyramid. So there are certain groups of lymph nodes in each of these different portions of the axilla. Okay, in the okay, so in different parts of the axilla, there are different groups of lymph nodes. In the anterior part of the axilla, there is anterior group of lymph nodes. Okay, so there is anterior group of lymph nodes. In the anterior part of the axilla, okay, along the anterior wall of the axilla, there is anterior group of lymph nodes, also called as pectoral group of lymph nodes. Along the posterior border of the axilla, there are certain lymph nodes, and these are called as posterior group of lymph nodes, or in the posteriorly there is a bone which is called a scapula, and so that's why they are called a scapular group of lymph nodes. Now laterally, there is a group of lymph nodes which is the lateral group of lymph nodes, or it's also called as humeral group of lymph nodes. Okay, and medially, it's not mentioned here, there will be medial group of lymph nodes as well. Okay, the medial group of lymph nodes as well. Okay, and in the center there will be a group of lymph nodes which is called a central group of lymph nodes, and in the apex there will be the apical group of lymph nodes. All right, so if you remember the pyramid, okay, so the pyramid has got an anterior wall, a posterior wall, a medial wall, a lateral wall, Okay, so similarly in each part there is a lymph nodes, anterior group of lymph nodes, posterior group of lymph nodes, medial group of lymph nodes, lateral group of lymph nodes. Okay, and in the center there is central group of lymph nodes, and in the apex there is apical group of lymph nodes. Okay, so this axillary group of lymph nodes are quite important because they not only drain the upper limb, they drain a major portion, okay, of the breast, the chest, okay, the chest and especially the breast. Okay, in breast, in males, you know that it's not much developed, whereas in females it's very important, okay, because they feed the child, and also there are incidences of cancer, okay, cancer breasts. So what happens in the cancer breasts, the malignant cells can go and hide inside the axillary group of lymph nodes. So if you detect a cancer of the breast and if you remove only that part of the cancer, okay, still you are not treating the entire cancer. You are not removing the entire cancer because the malignant cells can be hiding in the axillary group of lymph nodes. Okay, so until you remove this axillary group of lymph nodes, the cancer is going to be still there and it keeps on spreading it. Okay, so that's why we are going to read about the axillary group of lymph nodes. Okay, mainly because of its clinical importance, okay, especially with relevant to the mammary gland, okay, to cancer breast. Okay. All right, now let's see about this axillary group of lymph nodes. As I said, there are anterior group of lymph nodes, posterior group of lymph nodes, lateral group of lymph nodes, central group of lymph nodes, apical group of lymph nodes. I forgot medial group of lymph nodes are also there. Okay, so I didn't mention that because there are only a few. Okay, so the anterior group of lymph nodes, they are present along the lateral border of this pectoralis minor. Okay, so here this muscle is called as pectoralis minor. So along the lateral border it is found. Okay, the anterior group of lymph nodes, and they accompany lateral thoracic arteries and veins. They drain the anterior, this is important. Okay, they drain the anterior thoracic wall and most of the breast, especially the superior lateral quadrant. Okay, so here you can see the breast. Okay, the breast can be divided into 4 quadrants. If you draw a line, vertical and a horizontal line passing through the nipple, okay, so you can divide it into 4 quadrants: upper medial, upper lateral, okay, or superomedial, superolateral, inframedial, infralateral. Okay, so the supralateral component, okay, the supralateral component of the breast, it drains into the anterior group of lymph nodes. Okay, it goes into the anterior group of lymph nodes. So that's why this lymph node is very important. Okay, the next one is the posterior group of lymph nodes. They are present along the posterior wall of thorax, along the subscapular veins, and they drain the back. Okay, that is the posterior thoracic wall and the scapular regions. The lateral part, which is present near the arm, they lie around the axillary vessels. Okay, they lie around the axillary vessels and drain the lymphatics from the upper limb, except those accompanying the cephalic vein. Okay, except those accompanying the cephalic vein. Okay, the lateral group of lymph nodes. Okay, so they arise from the upper limb. All the lymphatics from the upper limb, it goes towards the lateral group of lymph nodes. Okay, that is which is along the basilic vein. Okay, along the line of basilic vein. This is the posterior group of lymph nodes. Okay, the posterior group of lymph nodes. Okay, the central line group of lymph nodes, they lie in the middle of the axilla. Okay, along with the fat and the axillary veins. Okay, you know the axilla is the portion where there is hair. Okay, in the between the upper arm and the chest. Okay, So the axillary vein, along the axillary vein and arteries, they are present, which is the central group of lymph nodes. And why it's called as central? Not only because it's located in central, it receives the lymph from the anterior, posterior, and lateral groups. Okay, so they receive the lymphatics from all the other groups as well. Okay, and from the central, it goes to the apical group of lymph nodes, which is present in the apex of the axilla. Okay, they are present in the apex of the axilla. Okay, so the lymph from the apical group, and then these are the veins. These lymphatics, they receive veins from the lymphatics from the central group, as well as the lymphatics around the cephalic veins. Okay, from the cephalic vein. Why am I insisting on this one? Suppose if there is an infection of the finger. Okay, say if there is an infection of the little finger. Okay, a diabetic person, okay, who is having an infection of the little finger. Okay, so what happens? The infections, they travel along the medial aspect. You know, the little finger is along the medial aspect. So they go along the medial aspect, and then they will affect the lateral group, so lateral group of lymph nodes. Whereas if it is present in the index finger, okay, in the index finger, they travel along the cephalic veins. They travel along the cephalic veins, okay, and then they go and directly affect the apical group of lymph nodes. Okay, so that's why we need to know the different groups of lymph nodes. Axillary group of lymph nodes are very important. Okay, and definitely you can expect questions from this one. Okay, not only in this topic, but also in the other topic, which is the mammary gland. Okay, in the mammary gland also, we will discuss about the lymphatics. Okay. Now that 75% of the lymphatic drainage from the breast, it goes into the axillary group of lymph nodes. Whereas 20% they go to the ipsilateral parasternal lymph nodes. And a small percent, what is 75 plus 20 is 95. Okay, so 100 minus 95 is 5%. Okay, so around 5% or sometimes even less than that. Okay, it goes into contralateral parasternal lymph nodes. Okay, what is this contralateral parasternal? Parasternal. Parasternal means it is parallel to the sternum. You know the sternum bone? It is parallel to the sternum. Okay, so from the axilla, you know the upper lateral, okay, and the upper lateral and lower lateral, they go to the axillary group of lymph nodes. But a small portion along the medial side, it goes into the parasternal group of lymph nodes. And sometimes this lymphatics, you can see that it is going to the opposite breast also, opposite side breast also. Okay, so that's why whenever you find a person with cancer breast, it's not important to check only the breast which is affected. You should also inspect the breast on the unaffected side, because there could be another cancer which could have spread from here to the opposite side breast as well. Not only the breast, but also the axillary group of lymph nodes. So when you inspect the axillary group of lymph nodes in a person with axillary in a cancer breast, okay, so not only you should inspect or do the examination of the part of the axilla on the affected side, but also on the unaffected side, because the cancer can spread from right towards the left. So that's why it is important to examine the axillary group of lymph nodes both on the affected as well as on the unaffected side, because the cancer cells can spread to the opposite side also. Okay, so that's why this is very important. Okay, so now here you can see a lady. Okay, so she has undergone a surgery which is called as mastectomy. Okay, what is mastectomy? Removal of the mammary gland. Okay, so she has undergone a surgery which is called as mastectomy. Okay, on the left side. Okay, left-sided mastectomy. Okay, so the left-sided mastectomy is being done, following which this lady, this woman, presents with a swelling. Okay, he presents with a swelling which is painless. Okay, along the along the left upper lip. Now, why there is this swelling? Why there is this swelling? Any idea?
Because the lymph nodes are the
Yes, good. So during this surgery, they would have removed the mammary gland as well as the axillary group of lymph nodes. Okay, as well as the axillary group of lymph nodes. So when they remove the axillary group of lymph nodes, so what happens? The lymphatics will find it hard to enter into the circulation. Okay, it will take time for when there are no lymph nodes, because the lymph nodes, you know, that they help in pumping the lymph from the distal towards the proximal aspect. So when these lymphatics are removed, there could be a blockage and that could cause a lymphedema. Okay, it could cause a lymphedema on the left upper extremity following mastectomy. Okay, so that's this case. So it could be painless if there is no infection. However, if there is an infection, it could lead on to what is called as lymph. Next slide. Okay, so that it could lead on to what is called as lymphangitis. I'll show you the picture. Lymphangitis. Okay, lymphangitis. So here you can see this person has got some injury in the finger, the index as well as in the thumb. Okay, and what happens? Not only the finger is affected, the infection of only the finger has to be affected, but the entire upper limb is affected. You can see the red inflammations. Okay, so that's because the inflammation spreads along the lymphatics. Okay, spreads along the lateral aspect of the lymphatics along the course of the cephalic vein. Okay, and it will affect the apical group of lymph node as well. This is the same person after he has recovered. Okay, after his partially recovered knee. Okay, because still you can still see the redness. Okay, so this lymphangitis. Okay, lymphedema is without any infection. If there is an infection, we call it as lymphangitis. Okay, so this picture here, it shows along with it certain lymph nodes. So here you can see the cubital group of lymph nodes, also called as epitrochlear lymph nodes, and the axillary group of lymph nodes. Okay, the epitrochlear, they follow along the basilic vein. Okay, and also this forms the epitrochlear lymph nodes. If they are enlarged, you can suspect certain diseases. Okay, like tuberculosis, and one of the most important ones which you can see in the clinicals. They will be telling you it's not the most common. Okay, but if the epitrochlear lymph nodes are enlarged, you can suspect any lymphoproliferative diseases, as well as one of the sexual transmitted infection, which is the syphilis, which is rare these days. Okay, so the epitrochlear lymph nodes near the cubital region, that is near the elbow part. Okay, near the elbow parts, which is called as epitrochlear lymph nodes. Why it's called as epitrochlear? Trochlear is, you must have learned what is trochlea. Yesterday's session, Dr. Ansa must have told you the lowermost part of the humerus, that is trochlea, right? The inferior part of the humerus. So there are some lymph nodes which is present above the trochlea, so that's why it's called as epitrochlear group of lymph nodes. All right. So axillary lymph nodes, as I said, most common site for metastasis. Metastasis means spread. Enlarged axillary lymph nodes in a woman suggests the possibility of cancer. Okay, sometimes you might not find any lump in the breast, but the axillary group of lymph nodes might be enlarged. Okay, if the axillary group of lymph nodes are enlarged in a woman, okay, suspect cancer breast. Okay, there could be a hidden cancer which is present in the breast, and you can suggest the person to undergo mammography. Okay, mammography which can detect the cancer of the breast. Okay, infection of the upper limb causes the axillary lymph nodes to enlarge. The axillary group of lymph nodes may be excised to prevent metastasis. That's what happened in the previous case, and the person had a lymphedema. Okay, long thoracic nerve and nerve to latissimus dorsi, they are very close to the axillary group of lymph nodes, and they can be damaged. Okay, long thoracic nerve and nerve to latissimus dorsi, they are very close to this axillary group of lymph nodes, and they can be damaged. And this also I give you as an homework. Find out if long thoracic nerve is injured and nerve to latissimus dorsi is injured. Okay, Dr. Vijay will be taking about this lecture tomorrow. Okay, tomorrow 10:45, his lecture will be on this topic. Okay, but you try to find out like what happens if long thoracic nerve is injured and the nerve to latissimus dorsi is injured. Okay, so your questions can be asked in a clinical scenario like a person has undergone a mastectomy surgery, okay, during which the axillary group of lymph nodes were been removed, following which the person had these features. Okay, so which nerve is being affected? Okay, so like that. Okay, and inflammation of the lymphatic vessels, you already know that this is called as lymphangitis. Okay, itis means inflammation. Okay, so lymphangitis. Okay, I think that's it. Okay, so you can refer Snell's or Gray's for your reference. Okay.